Tom, I think I've done about 250 of these interviews. I've never done a commercial endorsement or an endorsement of anybody, but I want the public to understand that the 5 years that I spent as the chancellor were very frustrating in trying to deal with the medical school question. And when you came in, you were really a breath of fresh air. And I really appreciate you being here. And I've told everybody that if you leave, I retire. So with that in mind, why don't we have a 4-year medical school in Las Vegas?
Well, thank you for that. And first, let me say I'm not going anywhere, at least not for the time being, because I'm really committed to trying to solve this issue. The question of why is basically an artifact of history and geography. I don't know of another state where a school started, as many schools did in the late 60s, early 70s, in the traditional land-grant university, and then another city just exploded elsewhere in the state. And I think everybody believes that if the school started now, it would start in Las Vegas. But that's not the way it happened. So I think we're trying to solve a problem not of our making, but just of demography and geography, and trying to find the best way out of that. I think there will be 2 schools in the state. I think that's a little unfortunate because the population is really not great for 2 schools. If you look at the country, there are 85 publicly funded medical schools. That works out to about 1 school for every 3.5 million people, roughly. And we're not there yet. And we're talking about 2 schools. So it's a bit overdone, but I get the geography and I get the history, and I understand that this is really unique. About the only state that's similar might be Arizona, where larger population center developed. But to be fair, they have had a rocky go, and they've gone through some difficult times to get to where they are now with 2 campuses under 1 school. So I think the point of this is that there will be 2 schools eventually. The question is how to get there in the most cost-effective way. The whole question is not how does UNLV get a school of medicine. The whole question is how does publicly funded medical education serve the state? And I think part of the answer is first a campus and then a school in Las Vegas. But we have to be very careful about how we do this. There's a lot of focus on medical students, and that's important. But we have to have an equal focus on residency and fellowship training. That's where the payoff really is in terms of keeping physicians here. So the reason I answered what I did early on about staying is I'm absolutely committed to trying to contribute to sorting this problem out, because I think that it's critical to the state's future. If we do this right, if we work towards 2 full campuses and the residency and fellowship training on top of it, and really grow the pipeline to train physicians and do the research necessary to improve care, I think we could do great things. If we do this wrong, we could really blow up a very precious enterprise, and the state could be the worse for it all the way around.
You know, you can start a law school, which they did 12, 15 years ago, and the investment is X. You start a medical school and it's triple X, triple X, triple X. How much money are we talking about to do this? I mean, you talk about UNLV having a budget of $500 to $600 million a year. Medical school could have that, couldn't it?
Our budget right now is $160 million, of which the state provides 30. It's generally quoted around the country that the operating costs for a medical school are in the $30 to $35 to $40 million a year range. So that's what it would cost for a second school. I think we have to get to that point eventually. I think we could have an awful lot of impact by having a second campus, which I think would be less. We're actually working right now to develop a financial model for a second campus. I think it's more in the $10 to $15 million range. But that's just the state piece. What you have is a huge clinical enterprise that we have to build, more physicians, more attending physicians, more specialties, many more programs. We have to have hospital relationships. We have to support the residency and fellowship training along with the hospitals who would support it, as would the federal government. So it's a very complex enterprise. It's way different from a law school and even different from a dental school because of the huge clinical network that has to be built for the clinical training.
And it has many pieces to it.
Many pieces and lots of relationships. You know, we're community-based. We don't own much of anything. We have our school and we contract with physicians and hospitals and healthcare agencies. I sign nearly 1,000 contracts a year to to create the relationships around the state for our students and our residents to work. I mean, it's a huge, complicated enterprise.
Well, I have to tell you, I think that most people would just be overwhelmed by it.
It is complicated, and I would say in certain regards it's more complicated as a community-based school, and then it's doubly complicated because of the statewide issues that we're dealing with. So what I hope, there's going to be a big discussion coming along here about this whole issue. This is going to be a very intense many months with regents meetings coming up and media events and whatnot. I just hope that people will focus on the sequential steps that will get us to the right endpoint. And as I said, I fully believe that we will end up with 2 schools. We just have to figure out how to get there in the most cost-effective way.
Tomorrow, let's go on. Appreciate you being here.
We'll do it.
I always learn from you.
Happy to be here.
Good deal. I'm only going to give you 7 minutes to talk about this next question, but what do we need to do to build the academic medical center here?
Well, one answer to that question would be we need a clear plan and a clear commitment to which everybody subscribes. One thing that I've said many times, Regents meetings and other places, is I'm not defending a particular position. I'm making recommendations for what I think best based on my experience. Whatever the Regents, governor, state legislature decides to do, we need to get behind it and really hammer the solution to this. If we could develop that plan, then I think we could really start to talk to donors, talk to the media, talk to employers, talk to businesses, and get behind a collaborative approach that says the University of Nevada School of Medicine, UNR as our host, UNLV as the major partner in Las Vegas, University Medical Center as our major hospital partner, the potential for other partners. There are other hospitals that are interested in collaborating at a very high level, and we're talking to them. We get all those people together and we say, look, we are prepared to really build, to focus, to have a clear direction, a clear goal. We're going to build this campus. We're going to start to recruit medical students from Las Vegas who might now be leaving the state to go to medical school elsewhere. We're going to expand that class over time. We're going to build clinical research. We're going to feed those students into new residency programs. Let's all get behind that vision. So I think the global answer to the question is commitment and plan. This school has been harmed by a lot of dissension, a lot of conflict, a lot of difficulties over the years. And if we got behind this from the governor on down and really hammered this plan, I think we could do good things. And then you start to target what kinds of residencies. We have a very well-developed spreadsheet, a very well-developed plan for somewhere in the range of 170 to 200 new residency positions. We have a total of 200 in Las Vegas now. So we're talking about doubling, basically, the graduate medical education in Las Vegas. What would that take? $30 million total a year, about half of which would come from Medicare and come from the federal government to support residents. So we've got another bill here of $15 million for faculty support, research development, new program development, staff to support this. Hospitals will provide some of that. I think the state may have to provide some of that. The days when you would just start a residency program and the federal government would support all of it are long gone. And in fact, that support is going to decline over time. So that's not the total answer. If we're going to grow residency and fellowship training to have opportunities for our students to stay in the state, we have to think about this as a statewide enterprise. The governor has to have an opinion here. The legislature has to have an opinion. What kinds of residencies, what kinds of fellowships? You know, we try really hard to cobble together new programs. We just got approval for a cardiology fellowship. We're going to do that in partnership with local cardiologists. We're going to do the same thing in GI. We're going to try to do the same thing in pulmonary critical care medicine. We just recruited an outstanding academic orthopedic surgeon around which to build an orthopedic program and develop a residency program, again, with local top orthopedic surgeons. I mean, we try to do the best we can with very little support. We've got to have a much bigger enterprise here in a major venture that everybody subscribes to make this happen.
Well, I'm 60 years old. I can recall being 15 and being told about the medical school. Yours was formed about the same time as Arizona's and Utah's and New Mexico. We got 50 years of negative politics, where every time there was an effort made to start it, somebody threw the anchor out of the boat. Isn't that the biggest problem you've got?
I think it is, but I get the sense that there's a convergence of vision. I really feel, and part of the reason I came was I got just this intuitive sense that good things could happen, that there could be sort of a coming together, because people realized how much the school had suffered, and realized how much medical care suffered in Nevada because of that, especially in southern Nevada. So I'm starting to feel like there's a coming together. But I think the coming together has to be around a near-term plan and then a longer-term plan. Clearly, there are many constituents who want a full medical school in Las Vegas. I'm totally fine with that. How do we get there? What do we do next? And how do we get there in a coordinated, concentrated way that everybody's comfortable with, everybody's on board, we kind of keep all the parts moving at the same time, and everybody can speak to the same message. So whenever the topic comes up, everybody is on the same message. So the legislature hears the same thing, the governor hears the same thing. I think it's coming together.
Well, I'm pleased. I hope so. I really hope so, because it's such a critical issue to the state. And I look at the other states that have put these things together, and my gosh, it embarrasses me and shames me to believe that we've sat on our butts for so long and have done nothing other than fight between us.
Well, the other states are comparisons, and it is unfortunate. If you look at the medical centers in Arizona, Utah, New Mexico, they're much farther along. I'm sure that there are other factors, like, you can't blame one thing, but that's certainly a big piece of it.
Okay, tomorrow let's go forward. I'm learning a lot, and I hope that the public learns a lot about how complicated this issue has been, and the fact that we think we really have a potential to do something at this point.
I hope so. I just feel like we have to take advantage of this moment.
Good. Onward and upward tomorrow.
We'll do it.
Thanks. I'm always fascinated with the way that academics deal with solving problems, and that is, they have meeting after meeting after meeting after meeting. Nothing is accomplished other than to appoint a committee, then has a subcommittee. And then, of course, you have to have a report. You have to have an analysis made that somebody from the outside will come in and make. And I'm not so sure that the answers that are going to be brought up in one of those commission reports aren't always the anticipated answers. So we've done it again. New report. What do you think?
Well, just to be clear, it's not my report. So yes, academics do that, and that is our bent. But this was commissioned by the Lindsay Institute in collaboration with UNLV. The specific question was, what is the economic impact of a medical school in Las Vegas? This is a consultant who's consulted widely around the country. They're fairly frequently used, especially for a lot of the new medical schools that have come along in the last few years. And they focus a lot on economic impact, and they have some fairly standard formulas for that. And I have no quarrel with that. There clearly is economic impact. There's clearly value to having a medical school. What the report does not address so much is feasibility, funding, state funding that's required, facility support, capital support by the state for facilities. There are lots of feasibility issues. It also sets out a date certain. It says that they recommend that a UNLV School of Medicine form as of January 1st, 2020, which is a pretty short time frame. Talk about a collaborative relationship between the University of Nevada School of Medicine and UNLV, which is good. That's what we've talked about as well with the regents. And that there should be a strong collaboration. There should be a class that starts in 2017, and then that class size grows, and then the school cuts loose in 2020 and becomes a separate school. The basic process is more or less what we've talked about, but it doesn't speak at all to the feasibility of that process, the timing of that process. I think it's a little short. Their population projections, I think, are a bit excessive compared to what the state demographer talks about. Their projections talk about a population upwards of 3.5, 3.7 million by 2030, I think it is. State demographer does not call for anywhere close to that population. So you've got to think about tax base. You have to think about the population base to support a second school. if you think about the very first opportunity that the state would have to weigh in on this, that would be the 2015 legislative session. I can't imagine that even an appropriation in 2015 would lead to provisional accreditation of a regional campus so as to enroll students in 2017. I think that's fairly overly ambitious and overly aggressive. But a lot of it has to do with money. A lot of this comes down to money. I mean, sure, a medical school would be great. Economic impact is great. We know that we need this. We know we need to get there. How do we get there? If money were no object, I think we could move everything along, both the medical school and residency and fellowship training. But if you think about the numbers that I talked about in previous days, we have maybe 10 or 15 million to start a campus. That's about the same amount of money as what it takes to fund the residency and fellowship training that I talked about. Now suddenly we're talking about a school in 6 years that would be more in the order of 35 to 40 million a year, plus facility support, which we know nothing about at this point. The state has no capacity for capital improvement, as I understand it, for several years. So it just keeps coming back to money. All I'm trying to do is to get people to not focus on the report. I think the report says what it says, and we sort of expected what it would say, which is there is economic impact from a school of medicine. That's fine. The question is feasibility, funding, how to get there in the smoothest way. And I just wish we could stay focused on that next step, knowing that a school is the step after that.
I once asked the president of a university that did not have a medical school if he wanted a medical school. And he said, absolutely not. But let me tell you something. Presidents get fired for two reasons: medical schools and football teams. I have to have a football team. I don't have to have a medical school.
Yeah.
What about that?
I think that medical schools are very complex. They're very different organisms compared to the rest of academia. There's a lot about the rest of the university setting that's quite similar, whether it's geology, English, engineering, business. Medical school is a whole different animal, and it's because of the clinical training, the clinical systems, the hospital contracts, the relationships, dealing with full MDs who are into many years of advanced training. It's a very complicated system. Having said that, there are enormous benefits to having a school. It stimulates biomedical research. It provides collaboration with other parts of the university. It's a huge community connection. It connects the university in many, many very important ways with the community. Some of what that president was reacting to, chances are, is not so much the medical school, but owning university hospitals and owning large health systems. That is a very complicated issue. And many universities over the years have spun off their hospitals to private ownership, because it's one thing to train medical students and residents. It's another thing to run a $2 billion a year hospital enterprise. And that is more complicated, but we're not talking about that. So it's not quite the same.
Appreciate it.
Beast.
I'm learning.
Good.
I'm learning.
We'll keep at
Tomorrow
it.
we'll keep going.
Good.
Appreciate you being here.
Enjoy it.
You have medical students, then you have residency programs and all of these things that kind of go together and that last for years. You go to law school for 3 years, they throw you out, you go out and you practice medicine or law. The question I have is, isn't the field of medicine so big that it's very difficult to swallow the whole thing?
Well, it is, and we have that problem. We have really good primary care training programs, for example, and we turn out good primary care physicians. We actually are ranked first in the country of all medical schools and hospitals in the proportion of our trainees that end up in primary care. That's a good thing. The state needs a lot of primary care. But there are huge components that we don't have. So we have 20, 25, 30 different training programs for residents and fellows. A typical full medical center, a big medical center that you might know, might have 80 or 90 or 100 different programs. We are way short in terms of specialties. And the problem with that is that, as we all know, physicians tend to end up where they do their residency and fellowship training, not necessarily where they go to medical school. And in fact, we're losing a fair number of our students who leave the state for various programs that we don't have, or for programs where we may not be as strong as we could be. And they sometimes come back and they sometimes don't come back. And as I've told you here on this show before, if you graduate from our school and leave the state, you have a 40% chance of coming back. If you graduate from our school and stay to do your residency, you have an 80% chance of ending up in the state. So the payoff is huge. And that's why I keep focusing on the residency and fellowship issue. It's one thing to have a pipeline of students, and I do believe that there is a pipeline of very qualified, especially Las Vegas students, who leave the state after high school for undergrad and education and don't come back to see us for medical school. So I think there's a pipeline of students that we want to keep in the state, that have a good chance of staying in the state eventually. But it's the residency and fellowship training that really is the issue after that. And we really need to balance the investment. So to have an inordinate focus on medical student teaching, just to say that we have a medical school in Las Vegas, is not necessarily going to achieve our objective of a full pipeline of training. I mentioned earlier that we were working very hard to develop cardiology fellowship, GI fellowship, critical care fellowship, orthopedic surgery residency. There are other programs beyond that we need to focus on so as to have opportunities. But as you said, very complicated. I mean, that requires really high-level systems of care, attending physicians with high levels of expertise. It requires research development. We could talk about that at some point. We have to have a network of research practices where you can do clinical research so as to improve clinical practice. There's so much more about residency and fellowship training that has to be developed. The hospital relationships, it's very, very complicated. So my plea is that as we're focusing on developing a medical school in Las Vegas, which again, I think is going to happen and that should happen at some point, we've got to invest in the residency and fellowship training. And as I said before, the order of magnitude of the financial investment is roughly equal. So you can put roughly $15 million, $20 million a year into building a campus or into residency and fellowship training, but you can't spend the same dollar twice.
How did we get so far behind Arizona, New Mexico, and Utah?
They invested heavily. I mean, they really did. Plus, they built fully integrated health systems. So they have a concentration of hospital care, of outpatient care. New Mexico, for example, Paul Roth is the dean and the vice president for health sciences there, who's a graduate of our school, actually, from the early 70s. He is one of the longest serving deans. He's been dean for 20 years at New Mexico. He has concentrated a tremendous amount of investment by the state in the university hospital, in clinics, huge system of clinics in Albuquerque, and now a huge system of clinics around the state. So again, accident of history. What if the dominant city in Nevada had always been Las Vegas? What if that's where the school started 40 or 50 years ago? What if there was a major investment in building a university hospital and then clinics around the city and then reach out to rural areas? It would have been a different history. But I also think there's an issue of a mentality of investment. We really have to spend some money here, and I think it's up to the state to decide what they can afford and where they're going to put whatever precious new money they have in upcoming budgets. We traditionally have just not done that here to some extent, and we may have to think about doing more.
The private sector here has an awful lot of money, a lot of concentrated wealth. And it seems to me that we've never been able to talk those people into financially supporting a medical school. And am I wrong? But it would seem to me that without private funding and support, you're not going to make it.
Yeah, if you look at all the great medical schools, they all have amazing donor support, philanthropic support. But that gets back to the message. I'm guessing if I were a donor with major potential here, I would be getting so many different messages, such a conflicting set of information. I wouldn't know where the best place to put my money would be. I think we have to have a very consistent message. We have to have everybody in this town on board with the same message that says we're going to do this first, and then we're going to do this next, and here's how your money is going to be invested, and here's what's going to come out at the end in terms of better medical care, better physicians, more physicians. Consistent message.
You know, one of the things that pleases me so much about you, and that is that you have a home here in Las Vegas.
Mm-hmm.
You and your wife spend an unbelievable time here, and that's so critical and very important. The previous deans just didn't do it.
I understand that. I try as hard as I can to make clear that I'm committed to making this happen, and to helping people understand that I believe that I'm getting to understand well what the situation is, and to understand the people and the opinions and the forces here. I don't know that people understand how much we respect this enterprise, that we believe that this work in academic medicine, in training medical students and residents and physicians, in doing research, we believe this is of the utmost importance. I mean, this is a life's passion, and it transcends a lot of the politics and a lot of the fuss that I've experienced in the last 2.5 years. And if you kind of think about what's really important here, is it all of the cacophony of different opinions, or is it having more doctors and better doctors? It helps to kind of keep my mindset.
So tomorrow, let's wrap it up.
We'll do it.
At least until we get you back in a couple of months. Thanks for
Anytime.
being here.
Happy.
You know, I've long thought that none of these universities are going to make it unless they get grant money, research money, that sort of thing, and that's what really sets apart the great schools from the mediocre or the poor schools. You've recently gotten a huge grant. Talk about that.
It's very exciting, and it's exciting on several levels. One level is just the grant itself. This is through UNLV. They are the principal grantee. The School of Medicine is the major partner, and it's a very tight partnership with joint appointments of the grant leaders between the two institutions. It's a very complex grant. It's $20.3 million over 5 years, so about $4 million a year. It supports the infrastructure, pilot grants, seed money, startup money for clinical research, and with partners around the West. So Nevada is actually viewed as the principal grantee, with partnerships in Montana, Wyoming, places that are dear to your heart, Idaho, Hawaii, Alaska, amongst others. The purpose of the grant is to stimulate clinical research and to provide the pilot funds, the mentorship, the guidance, the feedback, the support, so that an investigator who's got a good idea but not a lot of experience can ramp up their work, get some support, get a little staffing, get some data, start to think about how to submit that for larger funding at the federal level. So it's a huge think of it as a stimulus grant. I mean, it stimulates tremendous amount of activity, a lot of which will take place in Nevada. So it's very exciting, and it's a great example of the kind of partnership that can take place here between the School of Medicine and UNLV. So I'd like people to think of this as an example of what I'm talking about with regard to campus development, where the School of Medicine as a statewide entity can be a partner with the major local research university and do good work. It has the potential to be enormously influential, and it is the biggest grant ever in the state of Nevada, and it's a huge amount of funding. Having said that, your comment is interesting about the need to get these grants to be a great university. It also takes investment. So back to some of our previous discussions, it's generally believed by deans of medical schools, presidents of universities, that a grant portfolio requires as much as 20-25% investment, meaning that if you have $10 million in research grants, you've got to put maybe $2.5 million into it in other types of support, facility support, staff support, other types of support. Research grants don't make money, they cost money, but they stimulate activity. So that grant leads to another grant, leads to another grant, which might lead to some commercial spin-offs, which might lead to a biotech company, which might lead to jobs over here. So it does have tremendous impact, but again, it's another area that requires investment. So when you go back to what you asked about before, why don't we have what other states have? There's still an investment issue here. And it's hard to get this kind of grant. This was an enormous amount of work by a lot of people between the School of Medicine and UNLV. Huge breakthrough. Now we have to keep it going, keep the momentum, keep investing, keep putting effort into this so that that grant will lead to others beyond that. As I said, it's also an example of the kind of partnership that can take place between the School of Medicine and UNLV. We have great partnerships, for example, in sports medicine. So the director of our sports medicine fellowship that trains sports physicians is also the team physician for UNLV and staffs the UNLV athletic training room. And the reason I know this is that I was over there last week actually working with them because I happen to have a background in sports medicine as well. And I just thought people need to see what good can happen here. If we are allowed to build the relationships that we need to build and build the training relationships and get into the community and make the connections between the two institutions, really good things can happen. And it gets back to what I said yesterday, which was this work is so important and we all have so much passion for it, and there are so many people working so hard to make good things happen that if we can sort of keep everybody on message and not get distracted one direction or another by a lot of political conflict, the good things will come out of all of this.
You know, we didn't take advantage of the period of time when this country was printing money.
Yeah.
Nevada was printing money, and we had all of that money all over the place. We never took a dime of it to invest in what we should have.
I know.
And I know that grant money has really dried up the last few years, so I congratulate you on that grant. And do you think it'll get us more?
I think so. I think this could be a huge breakthrough. There's an issue in research development where the first grant is the toughest, but getting the first paper published is the toughest. Once you kind of get over that hump, then you get a little bit of momentum. This grant has the potential to be renewed for 5 more years after the first 5. There are grants that will spin off of this. So once you get a little pilot data, you get a little data, get a little experience, and then you can actually write a more formal, larger grant that goes in separately from this. And it can actually stimulate a lot of other activity. Plus it brings investigators together. Research is a team sport, and you really have to get people together. One of the really exciting parts about this grant is the mentorship. So one of the things built into this is a junior investigator, an inexperienced investigator submits, say, a letter of intent. Maybe not the best, needs a little work, needs a little help. So we'll put somebody on that to give them some feedback, to help them think about their project, think about the methodologic approaches, think about ways to accomplish their aims. Submit another letter, maybe then submit a draft, a grant application, get some feedback on that. They just get better and better, and eventually when they go into the NIH, they'll do much better because they've had some development along the way. But that gets back to the issue again of critical mass. We are not big enough that we can afford to have little pockets of activity stuck all over the place. We need to get people together. I'd certainly like to see more collaboration statewide and see UNR, UNLV collaborate. There are some good things happening there as well that I can't speak to as much, but between the School of Medicine and UNLV, there are definitely good things happening. And we just have to build that collaboration. And it's a mentality. It says, forget the state politics, forget the North-South stuff. What's the right thing to do to accomplish this research project, to train this medical student, to train this resident or fellow? How do we get better medical care and better doctors out of all this? And if we stay focused on that, I think the rest takes care of itself.
One question, and for the final one today, I noticed that you've really talked to a lot of the county commissioners in Clark County as time has gone on. Your predecessor, I don't think, knew who the county commission was. Talk about that just very briefly and the need for that support.
It's incredibly critical. I think, I would not speak for them, but I do believe that they are more trusting that the school is committed to University Medical Center, more committed to Las Vegas, more committed to improving the quality of care. I think they understand better what we do in terms of our faculty members and our residents and fellows who see patients at UMC and in some of the outlying clinics. But it was a kind of digging out of a hole. I think there was a high level of distrust, mistrust, maybe lack of understanding. As you said early on, this is a complicated business and it's hard to explain to people who don't live in it.
So why don't we agree next time we talk, you'll give us further information about the relationship of the medical school with local governments.
Absolutely.
That's very
That'd be a
important.
great topic.
Okay, my friend. Thanks for being here.
Next time.